Hello everyone and welcome to Know Your Drug, powered by MediInsights, the ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceutical. We are here to guide you on Leuprolide injection, exploring the various aspects of Leuprolide, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of Leuprolide injection. Leuprolide injection is commonly prescribed for various medical conditions, including prostate cancer, endometriosis, uterine fibroids, and central precocious puberty. It belongs to a class of medications known as gonadotropin-releasing hormone agonists. Next, discuss dosage of Leuprolide injection. The dosage of Leuprolide injection varies depending on the condition being treated and the patient's specific circumstances. It is typically administered as an intramuscular injection, often on a monthly or quarterly basis. The exact dosage and frequency should be determined by a healthcare provider based on factors such as the patient's age, weight, medical history, and the severity of the condition being treated. Next, mechanism of action of Leuprolide injection. Leuprolide works by binding to and activating GnRH receptors in the pituitary gland. Initially, it causes an increase in the release of luteinizing hormone and follicle-stimulating hormone, which leads to a temporary surge in testosterone levels in men or estrogen levels in women. However, with continued use, Leuprolide desensitizes the pituitary gland, leading to a decrease in LH and FSH production. This ultimately results in suppression of testosterone or estrogen production, depending on the patient's sex, and a reduction in the symptoms associated with conditions such as prostate cancer, endometriosis, uterine fibroids, or precocious puberty. Next, side effects of Leuprolide injection. Common side effects of Leuprolide injection may include hot flashes, sweating, headache, fatigue, injection site reactions, mood changes, decreased libido, erectile dysfunction, vaginal dryness, and bone thinning with long-term use. Serious side effects are rare but may include allergic reactions, bone fractures, urinary retention, and worsening of symptoms in patients with metastatic prostate cancer. It is essential to promptly report any unusual or severe side effects to a healthcare provider. Next, important advice for using Leuprolide injection. Follow the dosage and administration instructions provided by your healthcare provider carefully. Store Leuprolide injection as directed, away from light and moisture, at room temperature. Inform your healthcare provider about any other medications, supplements, or herbal remedies you are taking before starting Leuprolide. Attend all scheduled follow-up appointments with your healthcare provider to monitor your response to treatment and any potential side effects. Avoid becoming pregnant or fathering a child while receiving Leuprolide treatment, as it may harm an unborn baby. Discuss any concerns or questions about Leuprolide treatment with your healthcare provider to ensure safe and effective use. Always consult a qualified healthcare professional for personalized medical advice and treatment recommendations tailored to your specific needs and circumstances. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for taking Leuprolide injection. Remember, knowledge is power, and being well-informed empowers you to make the best decisions for your health.